This video blog is going to answer the question about that I get often about veneers and the concern that people have that they're going to have their teeth done and then end up with a gray line along the gum line. This concern stems from the fact that when people notice that their friends have their teeth done, they usually notice it because there's something that's unnatural about it. And the most common thing that looks unnatural is if there's a gray line at the gum line. Now, that gray line can be one of two things. Well, three things really. The tooth underneath can be so damaged that the root is actually black. That can come from a tooth that's died or that has had a large amalgam in it, and so it's stained. The other thing it can be is decay, and that can even turn black. The third thing it can be, though, is if the crown was a PFM, porcelain fused to metal crown. When we first started doing crowns, we really only had metal materials to make them out of, and we had gold and we had silver metals. But later on, we started being able to laminate porcelain to the top of the crown and cover most of the metal. And over the years, we've had less and less of the metal showing, to the point that we got down to just a thin sliver right at the edge. Well, in the front, this can be an aesthetic fail. If you smile really big and show your gum line and you have a gray line right there, people don't notice, no matter how good the porcelain baked on top is, what color that tooth is. All they notice is the gray at the gum line. And that black line prevents a lot of people from fixing other problems about their teeth that they do have that bother them because they're worried about having that grody problem. So today's restorations, porcelain veneers and crowns, we can actually bond the porcelain directly to the tooth. The porcelains today are so strong that we don't need the metal underneath to give them strength. And so just to prove the point, I have porcelain on just 2 of my front teeth. Can you tell which ones have them? I challenge you to figure it out. I will say it's not the middle 2. So there's no gray at the gum line, the porcelain blends right in, and it's incredibly biocompatible. I notice that patients who have the metal crowns often have a reaction in the gum tissue right around that metal, and I just don't see that as much with the porcelain. I don't know if it's because sometimes maybe they have a metal sensitivity that we can identify, like a nickel allergy, because there's oftentimes nickel in that metal. Or other times it might be just that the metal margin tends to grab the plaque a little bit more, so they end up with gingivitis in that area where the plaque is sticking. Anyway, I hope this clears up one of the biggest concerns people have about fixing problems with their front teeth. So if you have a space in your front tooth, some old composite fillings or some old amalgams, anything that's bothering you and you've been waiting to do it because you're worried about the black line, then just know that there's a better solution nowadays.